Have you ever found yourself in the middle of a conversation you cannot even focus on the subject of it because negative emotions have just consumed your mind? Have you been mid laugh and stopped at a painful memory? Have you just been sad all day for no reason at all? Like nothing in this world could bring a smile to your face. Feelings of sadness and loneliness shadow each and every one of us, but sometimes they are appropriate. Sometimes we have these feelings due to an illness, due to a relationship change, due to a breakup, or even a death in the family. But these feelings are necessary and they're appropriate for healing and for our growth. A good thing about them is that they are temporary. They're not going to stay with you. If you have feelings of sadness and loneliness and worthless, and they continue and start to impair your everyday life, this can be something called depression. I want to briefly inform you on depression. First off, I want to talk about what depression is. I will also include in this presentation, the risk factors and effects of depression, along with treatment options. According to World Health Organization, depression is a common psychological disorder that can alter a person's mood, physical functions, and social interactions. Depression is a condition that has no single cause. A combination of genetics, biologic, environmental risk factors, they all play a part in the cause for depression. There are multiple symptoms of depression. There could be loss of interest in everyday activities, loss of appetite, insomnia, sleeping too much, the inability to even concentrate, irritability, restlessness, persistent sadness or hopelessness. You could have a significant weight loss or weight gain, even tearfulness or frequent crying, persistent aches or pains, feelings of worthlessness and guilt, and thoughts of death or suicide. Not everyone who's depressed feel all of these symptoms, but they sometimes tend to experience a lot. Depression is one of the leading causes of death in this world today. It is amongst the most treatable mental disorder, and without treatment, it can lead to a completely unnecessary and preventable death. Depression is known to increase the risk of suicide in adolescents. According to the National Institute of Mental Health, suicide is the third leading cause of death for adolescents, accounting for 12% of the annual deaths in this age group. That's around 2,000 children. Depression is often overlooked, misdiagnosed, or even undetected. It's easy to blame puberty or mood changes or hormones for this age group. The number one treatment is key. That's the number one rule. Treatment is key to depression. No one person can take blame for having depression or developing it. As discussed earlier, genetics do play a huge part in whether you will have depression or not. But depression, in even the most severe cases, is treatable. Treatment can include medications such as antidepressants, psychotherapy, sometimes even both. Everyone is different. There's no one-size-fits-all when it comes to treating depression. It is hopeful for myself, along with many others, that there is a treatment for this disorder. I've explained to you what depression is, the risk factors for depression, and most importantly, ways that are treating it and that there is treatment for it. As the JED Project Foundation says, depression can have serious and sometimes permanent consequences when left untreated. While we can't always prevent depression, we can prevent suicide. Everyone plays a role in suicide prevention. If you or someone you know may be suffering from depression or having suicidal thoughts, please seek help immediately. There are ways we can help in stopping this disorder claim the lives of our friends, acquaintances, and even, most importantly, our family. You could be the difference between life or death for someone who is having depression or suicidal thoughts. Know your warning signs.